All, this is Dr. Mobeen Sayed from drbeen.com. Welcome to one more show, the second one for today. And I was looking at, yes, Steve is first. Steve is first, DDS, Kamran, hi. So let me just very quickly check the placebo for Johnson & Johnson. 1 second, please. Okay, so I found it. I think I had actually gone over this in the past, but I forgot about it. My apologies. So if you see here, this is Johnson & Johnson, and they are saying in these studies, half of the participants will get a placebo instead of AD26CoV-2S. The placebo looks just like the adenovirus vaccine and is given the same way by injection, but the placebo contains no active vaccine. So that means it is still the adenovirus, but inside the adenovirus, there is no DNA for the spike protein. So it will not make the vaccine, or it will not make the spike protein and not train the immune system. So that means then it is fine that people who develop fatigue and myalgia, which I was saying, why did they develop it? Well, they still got the adenovirus, and so that could cause immune system reaction, and they could have this response. Rima says, Dr. Bean, do you need a flow assay, IgG, IgM? I will gladly send you one from my stash. Absolutely, which whatever you can send. So somebody had sent me bromhexine Thomas, so I'm going to go get it. Generally, it seems like I'm fine. I wanted to show you what I have been taking, or just, do you want to see my huge stash of supplements that I had been taking? Let me see if I can show you those. I have to find them. 1 second, please. So this is, let me share my screen as well. Oh, my screen is being shared. So here, this is one. So of course, if you see here, quercetin and zinc, then vitamin D and K2 and calcium, copper and selenium are not here. Turmeric or the curcumin, serotonin, and B12. So that is one. Then somebody had seen this before and said, do you rattle when you walk because you take so many things? The other I was taking was these. This is vitamin B1, then vitamin C, honey, Hanukkah honey with black seed oil. So here is black seed and Hanukkah, they kind of go together. Then omega-3, vitamin E, then I believe this was vitamin A, alive. So I just take generally one multivitamin daily. Anyways, that kind of gives me all the things that are necessary. And then CoQ10. You know that I'm a fan of CoQ10. And then on more specific side, ivermectin, and then antihistamine, some ibuprofen as well, but less, some acetaminophen just for symptomatic treatment. So these were the things that I had been taking. So thank you very much, Rima. All right, so how is everyone? Yes, melatonin. I actually could not find my melatonin where it was, so I missed on that one. I have to go find it. Doug says placebo looks like it doesn't say that it has the vector. Placebo has the vector, but it doesn't have the DNA in the vector. That's what I think. I may be wrong. Let's see. Using a placebo in the study allows researchers to see potential differences between the investigation vaccine and the placebo. The placebos in these studies will be sodium chloride, also known as saline. Thank you, Doug, for actually reading till the end. So yeah, saline, it's not even the vector. So then I'm surprised that people did develop other reactions. Famotidine, not yet. I was actually going to get famotidine today, but it looks like I'm feeling better. Oh, yes, yes. So the PCR. So Susan says, what is the PCR outcome? PCR was negative. So I hope that was true negative. Sipper Steve says, do you think that it would be beneficial for high-risk groups to take ivermectin along with the vaccine? Would there be any benefit and reduction of adverse effects? I think it is useful to take ivermectin because ivermectin has other effects as well. Imagine this for a second. Imagine I was actually sick with COVID. Imagine I am still actually sick with COVID. Did you see that as the ivermectin was started, how I was feeling congested and down and feverish 2 days ago? And so far, 3 doses of ivermectin. And I feel myself, I mean, fingers crossed, I don't want to jinx it. I hope I stay healthy. But I don't even feel whatever that thing was. So let's say it was not COVID. Let's say it was rhinovirus, or it was another human coronavirus, or it was something else. I was sick. What happened to that? That all just went away. So I think there is a benefit of Rima is saying, isn't it too early? It could be too early, yes. Dorothy says Novavax. My friend is an engineer working for the company creating. He says trials are going really well. New strains can be added, unlike mRNA ready in April. I love Novavax. I am still waiting for the Novavax results. I hope results are good. I love, at least from a mechanism point of view, I love it. I hope its results are as good. Mark says, will less effective vaccines select more variants of concern? I don't think so. So this one was not very good in South Africa, although they kind of had a paragraph in their document saying, well, we did not see any of the patients to have the 135 or other variants, and we would do more data analysis and come back with that. But why was it so bad in South Africa? TD says my wife should be on a holy card. Okay. Eric says, are these PCR tests like make 40 or 30 copies now to give negative results? I do not know what was the cycle threshold for this one, my kits. Rima says, today I heard that US hospitalizations were up. It is possible. We can look at the US. Let's see. So if I go here, Worldometer, Israel automatically comes up. So let's look at Israel first. Number of cases are still going down. Active cases are becoming less or fewer. Number of deaths are going down as well. Look at this, 8 deaths compared to 75 or 101. Or if I say 7 days moving average, then 60, 45, and so now they are at 23. Very good. So if I then go to US, active daily new cases. So if I put the 7-day, it is kind of consistent, 68, 70,000 for some days. If I say 30%, 3 days, sorry, 57, 78, 63, 71. So it has become kind of bumpy here and staying in this area. It has come down drastically, which is good, but it is in this kind of a zone here as well. How about active cases are not too drastically gone down? How about the deaths? I do not know hospitalizations I can see here, but if the hospitalizations increase today, unfortunately the deaths would follow a little later. So here, yeah, not that drastic, but still downwards, which is a good thing. France says heart. M. Gregory says to France, okay, so lying eyes, the vector doesn't have spike proteins, it has a gene to make them. Yes. Jan Art, if the vaccine don't work for some, as studies suggest, do the ones that vaccinated suffer from long haul symptoms if they catch SARS-CoV-2? Important question. They could die or they could become long haul. Yes. Doug says his question was akin to antibiotic resistance. Vaccines selecting VOC's preferentials. I have to think about this one. I have to look at that question once more. Yes, Jamie. Yes, I'm PCR negative. Can you imagine this? That I was more tense about becoming a long hauler than possibility of death. JTJ says Dr. Bean thought he had COVID, but he's not sure. So Island says, does Dr. Bean have COVID-19? So my test came back negative. Although every cool bean doctor I spoke with, they said because it is spreading here and you had similar symptoms, you should assume that you have COVID and just manage yourself accordingly. In 3 days, the change that has come is, number one, oxygen state settled at 98. It did not go down. Secondly, the fever I had the first 2 days, now I don't have fever. I had a little more tiredness the first 2 days. Today, I am less tired. I did become very depressed this morning. When I woke up, I was very depressed. Now, that may be because of the effect of the virus. I thought, all right, I'm going to get the virus-related psychological thing. But this was also, remember I talked about some of our members have complained about us. So we have the meeting with auditors tomorrow, and they have actually sent us a note saying that you are not compliant. So a majority of our business can become impacted severely. So of course I was concerned. So maybe that was the thing that caused depression. Maybe it was whatever it was. Now I'm better. But I am generally, as you can say, I'm generally doing well. I am fine. This is evening time now. So doing good. This is a good one. James says that, do you think we are headed for fourth wave? The fourth wave, if there is enough of a change in the variants to override our immune systems and vaccine shapes, then we might be headed for the fourth wave. I think it will not happen. Yeah, we'll see. They have. The thing is this: we have been working with these agencies for 4 or 5 years, and we never were the same processes, same content. We were never declared out of compliance and stopped the work. This is the first time. And again, the auditors came back and they said, It's not that they wanted to audit, not that they were saying we don't want to audit, meaning it's not initiated by them. They said we got complaints about you, and then we are starting our audit. And they said we have to audit if people are complaining. So, oh well. Compliance of the teaching material that Rima says, bring us all in the room. So Mark says, can you comment on 50% decreased antibodies with Pfizer vaccine and obesity? Mark, can you please tell me? I haven't read this yet. My whole last week was all focused on the long haulers, so I did not see anything else. So I'll have to do some research. So Kathleen, in the morning I was depressed, and so I actually thought that I would shut down the thing, and I'll say, you know what, done, fine. And then, of course, that was a temporary thing. Then I thought about it, talked with my team. Maybe the worst case will be that part of the business that needs to operate under compliance, we'll just shut down that part, and then the remaining part will continue to work. I may have to, our business might become decimated, and then we have to bring that back up. But in a situation where people are losing their life, my impact so far is a damage to the business, maybe it's hardship for some days, months, weeks. So I think I'll be okay. Franz says it seems normal to have sad, depressed thoughts with the BS going on. Absolutely. Thank you. Thank you. Yes. Arubaga says just have to increase Patreon revenue. Absolutely. Patreon revenue is at $260 or $70. So it is kind of a little less at the moment. Thank you very much, Robert. Denise, if he went to CVS, likely not given CT values, my friend who was positive. I just did not, I just looked at negative and I didn't care for anything else. I would look more deeply. Go fund beans, yes. Thank you. Thank you. This is actually, Jody, this is a very important one. Can we do a comparison chart for the approved vaccine side by side for pros and cons? That is what I was thinking. As I was going over these, I thought that the thrombotic events, there should be a comparison of this vaccine versus Pfizer, Moderna, AstraZeneca, CanSino, Sinopharm, and so on, or number of deaths, and there should be a comparison, or the severe cases, there should be a comparison. That will be a better way to look at it instead of one-off. So I was actually thinking about that maybe tomorrow what I should do is I should create that table and then put that data together. So thank you very much for bringing it up. Maybe that's what I should do. Barbara says, cat in my lap again. The cats, they love to just sit in the laps. Luffy has been sleeping on my bed for the last 2 days. Yeah. Although I'm as scared as I am of being long hauler, this also gives me this passion to figure out what is going on. One thing that makes me comfortable, of course, as comfortable as I could be, is that any long haulers that I've talked so far have been reporting improvements, either with medications or by own themselves. So there is this comfort that eventually long hauling is not going to be, and maybe again wishful thinking, but that is the data I've collected so far, and it is not a long period of time. I think it will not become long haul 10 years, 20 years, 30 years type of a disease. I think it is going to recover. We are going to recover from this. Kent, thank you very much. Yes, that is possible. I did not take melatonin though. Nina's saying who's selling the car. I'll sell my car first. Yeah. If you talk about, I was talking with my family this morning. I said, what broke my heart more than compliance, fine, that's a business thing. I'll have a bump in the road, then I'll bounce back, I'll do something and we'll be fine. What broke my heart was that folks who complained are actually the folks who are part of the, who are registered with the, with Dr. Bean. They have to be registered users to be able to complain. So Wayne says that I suffer from cluster headaches. The best thing is oxygen and new OTC nasal spray I bought online. It was all natural. I believe in oxygen a lot. Anyone with the cluster headaches I've seen, if they take oxygen, so there are oxygen canisters that are available for sports from Amazon. And as soon as there is a hint of cluster headache and you take oxygen, it works like magic in most cases. Will do, France. Thank you very much. So Sital Karki says, dear sir, can you please explain the serology post-COVID vaccination? Meaning what will happen in our blood in terms of antibodies. So what will happen is, let's say I get vaccinated today. Again, various vaccines are giving this data in with various durations. For example, AstraZeneca says if you get the vaccine today, then wait till 90 days, allow your body to keep developing immunity, that it would continue to do that for 90 days, and then you are very much protected. Now, what does that mean? During this 90-day, there is going to be first IgM produced. Usually IgM is produced, or the antibody system production starts within 14 days and onwards. So that means 14 days to 90 days, somewhere IgM will start. In case of COVID, IgM and IgG start together. I do not know in case of vaccine, IgM and IgG start together. Usually IgM comes first, then a little later IgG starts. So what would happen is that the patient or the person would develop IgM, then IgG, and then IgG would stay on for some months and then it would decline. It would decline because the body is not challenged by the virus or spike proteins anymore. But we will now have sleeping cells, the memory cells, memory B cells, memory helper cells, T helper cells, and memory cytotoxic cells. When the virus arrives again, then our cells would start responding, and at that time our immunoglobulins would go up as well. So that is how it should happen. Now, various vaccines are claiming various durations. For example, as you saw today with Johnson & Johnson, they are saying 14 days or 8 days. AstraZeneca said 90 days. Moderna and Pfizer say first dose, then booster dose in 21 days or 28 days, and then 7 days or 14 days after. And somebody had asked a comment that, do we need a booster dose for Johnson & Johnson? So far, not. I think for any vaccine, other than those vaccines that are already structured in a booster dose, there may be a booster dose needed if there is a vaccine change for variants. Otherwise, no. So Steve says, again, they showed better efficacy at 56 days in the FDA meeting. William says, I take Moderna vaccine tomorrow and extreme anxiety cause of the media saying lots dying from it. If I take a small dose, Xanax before the shot, will that interfere or cause any adverse events? No. So Xanax is going to help with the anxiety. It will not interfere with the vaccine at all. And good luck. I think you'll be fine. It has not been bad these vaccines. Yeah, there are chances. So yes, you can take Xanax if your doctor is okay with that. Yeah, that is fine. Jane says, which is worse, JJ or Sputnik? So Sputnik is, I didn't have this way of the data available for Sputnik. This is what I kept lamenting, that for Sputnik or for Sinopharm or for CanSino, this kind of data is not available. So we can put this data in front of us and start hammering it, but then there are vaccines that are being given to people which don't have that kind of data disclosed. Siddhartha says, is IgG production in COVID delayed, reduced due to immune system block, lymphopenia caused by COVID? So in most people, Siddhartha, within 7 days to 14 days, IgM and IgG is produced together. My thinking that why is IgG produced together instead of separately is the following. So let me take this comment down. Here is what I think. So if we follow a B cell becomes triggered, correct? And it becomes a plasma cell. A plasma cell is now making Ig, it always makes IgD, and now it is making IgM, correct? And then what happens is, so let's say this is the genetic material. This is the piece that makes IgM in the genes, in the DNA. And then let's say this is the piece that makes IgG. So normally what happens is, after some time, maybe another week, when you keep pouring enough cytokines on this cell, that the cell or its copies, one of them will decide, you know what, I should discard this piece and I would start using this piece to make IgG. That is called the gene splicing, right? So this would be spliced out, or in immunology, this is called class switching. So this class will be removed and this class will start. I think, let me back up for one more second. So because of this, normally IgM appears first, then it goes down. During this time, it is possible that IgE will also appear and go down, and then IgG would appear like this and then continue on. This is usually what we see. In case of COVID, we are seeing that IgM and IgG are going up together. That tells me that the severity of COVID is so intense that it causes so much of cytokine production that the cytokines that are responsible for class switching, which is IL-4, and so IL-4 would do the class switching, IL-5 would help with the proliferation. So these cytokines are so much that even the cell which was going to class switch in 1 week after, that is so hurriedly triggered that it does a class switch right away. So I think it is the intensity of the damage and the production of cytokines that causes very rapid class switching. And that is why IgM and IgG are together. France says, where did that comment go? This one, Navy Beans, report for duty and smash that hit that like button. Yes, please. So Life Waits With Me says, good God, they're trying to kill us. Why can't we just take Ivermectin? I'm 69, so I'm one of the ones they are trying to kill off. Ivermectin is helpful as well, yes. Nairi says, Dr. Bean, my colleagues are getting vaccinated, but I'm waiting for J&J. Do you think this is wise for me to wait a little longer or take whatever is away? So looking at J&J, although it is one shot, its efficacy seems lower and its side effects seemed more. But as Jody said, ideally we should do a comparison table to actually know that what I'm saying is correct as well. So J&J, looking at it today, it actually scared me a little bit. I didn't have this kind of a reaction when I read for the other vaccines. So there is a question that why does J&J get better with time? So all vaccines, Pfizer is saying that, sorry, AstraZeneca is saying that as well. They're saying that they're getting better. One reason for things to get better is that as the immune system continues to respond and continue to react to the vaccine that is bothering it, the number of cells would continue to increase, and that is how the response will become better. There's another thing, so that's called proliferation. So there's more proliferation. There is another thing called affinity maturation. Affinity maturation is that the more exposure the cells have to some antigen, and the longer they have that exposure, they'll keep becoming better and better at combating with it. Nancy says, good news from Ivermectin. Took last Friday. Taste is back and the gut issue is much better. Very, very good. Congratulations. James says, will there be a baby boom after the pandemic is over? I definitely believe that. Be curious says, Doctor say, please remember that the J&J vaccine data included data from South Africa, which would have affected efficacy data, is too premature. So if you look at, so I went over country data as well. So if you look at it separately too, the efficacy data is still in similar ranges. Oh, wow. Susan says, my cousin still has stiff neck and a massive headache every day since Pfizer, and this was over a month ago, and now cannot walk well. Acute. So did he not go to doctors? What are they saying? Yeah, so this seems like encephalomyelitis. Did he not go to the doctor? Are they looking at it? They should admit him. They should start managing him. This doesn't look right. Amir says 3 weeks after the second dose of Moderna, Quest test shows positive IgM and negative IgG. How to explain? Because the class switching has not yet occurred. And it is actually, a normal way is IgM to appear first and then IgG later on. And so a vaccine is not going to bombard our immune system that badly as the actual virus does. So it is possible that the IgM comes first, and another 7-8 days later, the IgG would be there as well. So I am sure that if you went another 5-6 days after, you would see IgG as well. This is normal. L says, yes, babies everywhere after the pandemic is over. Yes. Kids named Ivor and Mectin. That is nice. Machiavelli says side effects means it's working right. Correct. But these kind of side effects where there is neck stiffness or inability to walk correctly, that means there is the nervous system side effects, which are not right. Meaning the side effects like fever, myalgias, those are fine. For a couple of days, they are fine, but then they should go away. That makes sense, William. Laura, this is a good question. Can we compare the data on vaccines when they were done at different timeframes during the pandemic? Yes. More homework for me, but yes, it needs to be done. Mark, I haven't heard of the leukopenia because of vaccine. I have, of course, heard of leukopenia because of the virus itself. Dorothy says, can a nursing mother of a newborn take ivermectin if she gets coronavirus? So I'll give you three answers. From the textbook of pharmacology, Goodman-Gilman, edition 13th, they say that we have never tested ivermectin in a lactating woman because we know that ivermectin has been observed to be present in the breast milk. And because of that, it is never tried in humans because it can go to the baby, then it can be absorbed from the baby's gut and go to the developing brain. Baby up to 2 years of age still have the blood-brain barrier that is being formed. So they say, don't do it because it is not tested. It can cause permanent damage. So this is one study. This is the textbook. So I always take textbook over studies and then that over anything modern or latest, because latest things still need to be vetted out over time. There is a study that kind of counters this argument. In that study, they said that the ivermectin's amount lactated or present in the milk is tiny. And then it has to go into baby's mouth. From there, it has to go to the GIT. From there, it has to be absorbed. So a tinier amount is absorbed. And so they said it is kind of not harmful. And I have shown that study in the past here. So this is one package of information. Second is my opinion. And cool beans all know that I am always on the side of safety. So I never, ever give ivermectin to a pregnant woman or to a lactating woman. Second part of information. This is my way of practicing. Third is what I heard from Dr. Marek and FLCCC. They said they are of the opinion that the pregnant woman can be given ivermectin after the first trimester because the first trimester is when most of the brain and other tissues are being formed. I don't agree with this, but this is what they believe. And that means if they are okay with ivermectin crossing placenta and going on to the baby and still being safe, then lactating mother and baby would be fine as well. I am putting this last sentence in their mouth because they don't say it this way. I am just doing an extrapolation. So that is a third piece of information. So after giving you all that information, you can still make your own decision and talk with your doctor. My opinion is no. John Snyder says, people aren't having babies in lockdown though. Not enough love to go around. Faith says you're greatly appreciated. Thank you very much, Faith. Rima says, do you breastfeed if you are silica with COVID, if you're suffering with COVID? So looking at CDC, they actually say that it is healthy to breastfeed, and they have a set of practices for the mother to help prevent baby from getting the infection. Debbie says, I had meningoencephalitis from a vaccine within a couple of days and took 4 years to recover. It was from immune suppressive effect of vaccine and HHV6 attack my CNS after the vaccine. This isn't common, but sadly many of us suffer and blown off. And that is a thing that it can happen to any of us. So sorry about that, Debbie. Samir says, hello, sir. Are you Dr. Najib's brother? Yes. Barbara says, Wayne, you're cracking me up. Okay, so Sapal Steve, question. Do you know that what the drug companies are tweaking with their vaccine in order to increase effectiveness against the new viral variants? So what they're doing is they're taking the new genetic material from the new variant and then using that genetic material. So if I can quickly show it in an illustration. So I'm going to take the question out. So let's say here is the original spike protein, and this spike protein has a genetic material that is this way. I'm just making up things here. Then here is a variant spike protein which has some change in it. And the genetic material for this, let's say, is like this. And then here are some amino acids that are changed, which represent this change. And then the remaining part. So now this vaccine that contains this spike protein genetic material, when it will make the spike protein, it is going to make this. Now, this is not going to look like this spike protein. And so when the virus, this kind of a virus, will arrive in the body, our body would not be able to attack this part, and the virus can escape. So the change in their vaccine is going to be to incorporate this part so that we can make something against this. Now, there could be, and I was reading about one of the vaccine companies, they were saying that what we are going to do is we're going to keep this RNA, plus we'll put this RNA as well. So we'll keep protecting to the original, and we would also protect against this. So we are not saying now we protect B, let's say, this is A. So they're saying we're not going to do B and now we don't do A. We would continue to do both. So that would become a cocktail of the spike protein genetic material. Gold Country says, Has-Been is wondering if maybe we all should try to score some placebo before it is all used up. I think we should all get placebos, yes. Building Maker, thank you very much. Colin Hamill says, are there any stats out there that don't involve COVID-19? Did anyone even die of cancer? Seems we don't die of anything else now. No, actually, so whenever they say all-cause mortality, that means death because of anything. For example, today in Johnson & Johnson study, they had said we are reporting deaths in two categories. One are deaths because of COVID, and the other are deaths that are not COVID, that are all cause, other reasons. And all cause mortality, there were 3 deaths in the vaccinated group as well, but they were not related to COVID, other causes. Luffy's like Alexa. She responds to the word ivermectin. I hope Alexa doesn't respond. So Lift Weights with Me says, why are you now nervous about J&J vaccine? Is that a question for me, or if it is for me, I just went over the J&J vaccine data, and number one, it shows less efficacy. Number two, it shows more side effects, severe side effects. It shows less protection in severe cases as well. For other vaccines, the trade-off was fine. It may have its own side effects, but that percentage is lesser than the critical or long haul or death because of COVID. This vaccine didn't show that kind of efficacy, or maybe I didn't feel that comfortable because the efficacy was 70%, 80%, which may be okay, but we could end up in the remaining 20% as well. Other vaccines I saw had better efficacy. Thank you, France. GK says, William, trust your intuition. So I'll tell you about myself. As nervous as I am with the vaccine, still, if somebody says, here is a vaccine, I'll go take it. Whatever vaccine is available, I'll take it. Al says, I won't mind if Alexa orders me a bunch of ivermectin. So Alexa listened but didn't do anything. So that is the good part. Be curious. Do you know if the morbidity and mortality and the rate of ICU transfer among COVID patients is lower at their hospital? Are you talking about the FLCCCs? Letitia says, I love your way of practicing medicine and protecting the population. Thank you very much. Michael, I actually I had taken this note of talking about the nasal sprays. Then I started talking about long haulers. And now I wanted to talk about Johnson & Johnson. So I would talk about nasal spray. I just took note. Joe Gianotti says, as someone with chronic ITP and platelet count of 30,000, I'm very nervous about getting an mRNA vaccine. I have an appointment for one on Thursday. In your opinion, what's the safest option? I may wait. So this is a very specific thing. So from a vaccine's point of view, there is one case where the vaccine ended up causing idiopathic thrombocytopenic purpura. So the most important thing is the following. For example, if I am the one who has this and I need to go get the medication as well, the vaccine as well, I would have asked my doctor to be ready with the platelets and with the transfusions and those things. So if, God forbid, I develop it, I can take it. The question is, will vaccine cause immune system cells mutation that they would continue to make more antibodies that would destroy the platelets? That I do not know the answer to. So this is something that you should discuss with your doctor as well. He knows your history better to decide what is the right thing. And I would suggest discuss in the context of the doctor in Florida who developed ITP and then who died in 2 weeks afterwards. And in my opinion, that was vaccine related because vaccines have known to do this. However, please know that doctor did not have ITP before. And the folks who have ITP do not always get from the vaccine the same result. So there is no direct relationship. It is a chance and anybody can get stuck in it. Jen says, I thought that viruses never die but lay dormant when you are well enough to keep at bay. There are all kinds of viruses. And I know that some folks are, some people had actually said to me in the beginning, you say the virus be killed or those, and you need to go back to your medical school and learn that viruses are not living and so they cannot die. Viruses are not living like other living things, but still they can increase in number and they can be viable or they can be not viable. So viruses can become not viable, and then there can be viruses that can live in us for a longer period of time and we become their carriers and they can just sit in there. So all that can happen. You're welcome. Machiavelli says, but correlation, yes, it is possible. Yes. James says, would you take JJ vaccine if that was the only one available? Yes. I'll tell you the reasons. Number one, in my age group, it does reduce the efficacy. It does reduce the chances to 60, 66. In people with the higher age group, it actually reduces even better. So one, it is better as people age. Secondly, if it is the only thing, then your chances of becoming half as likely to get the virus is better than 100%. Samina, I know that you had talked about it before as well, and I had taken this note as well. It is actually here in my notes. I'm just going to take it again. And will do. So Robbie says, if there are 4 of us in a room and we have all been vaccinated, do we still need to wear a mask? Thank you. In theory, no. But let's talk about it for a second. Imagine that we have a vaccine given which is 60% efficacious. That means if there are 4 people in a room and they're all vaccinated by the same one, then it is possible that maybe one of them is going to carry the virus and become sick and make others sick as well. So it depends upon how efficacious the vaccine is. I would look at it this way. If the vaccine is efficacious enough from protecting the severe cases, then this is my opinion. Again, this is not a message to anyone else. My opinion is I won't bother getting some sore throat and some myalgias for a couple of days if I know that I would not become severely ill or I would not become a long hauler. So if vaccine is protecting for those, then it's fine. Gazar says thrombocytopenia has been seen after the vaccines as well. Yes, it has been seen. Yes. Be curious. I do not know about this one. So I'll have to ask them. This is a good question. Paul says, your answer about the vaccinated people in a room is after the time of vaccine to be effective, correct? Not in the first. Of course, yes. So if you just get the vaccine and go in, then you are as possible to get the infection as anybody else. And so, yes, you're correct. I am talking about when vaccine has become effective. Very good call out, Paul. So Lisa says, could you take the J&J vaccine if that is all that is offered to you and then later take Moderna? Yes, that is a good idea. Yes. I haven't gotten the chance yet to get my vaccine. William says, if you take Benadryl 50 milligram before the vaccine, then Q4 hours for the first day to ensure no anaphylaxis, would that decrease the vaccine efficacy? No. So the vaccine's efficacy is going to be reduced if immune system is suppressed, not if the inflammatory outcome are suppressed. Although inflammatory outcomes help with the immune system activation as well, but mostly there are people who actually don't develop any symptoms and they still develop very good vaccine response. It is the steroid that can suppress the immune system, but in anti-inflammatories, painkiller type things would not cause any issue. Machiavelli says, why metformin extends life? This is not known, but it is known. Maybe, I mean, one way is that it helps with the sugar control, but this is a separate effect for which we do not know exactly why. Richard said, do you know what PCR test will tell wild C19 from a vax? I do not know the kit name, but generally the concept will be that vaccine will produce antibodies that are against a spike protein. A wild case of infection will produce antibodies against everything. So if there is a kit that can look at antibodies against the spike protein and other parts of the virus, then it can look at the wild types. But most of the kits only look at the spike protein based antibodies, and because of that, they would still detect it. So now I'm getting a little tired. So if you are okay, we can stop in another couple of minutes. So there's a question. So would J&J vaccine be better than nothing for an older woman in her 60s with history of heart disease? Yes. Actually, interestingly, J&J vaccine is more efficacious in older people compared to younger. Chuck says, Dr. Bean saves lives as clinician, even more as a professor, and now even more and more as a YouTube creator. Yes. So if I get more patrons, I would just be a YouTube creator. But I only get 260 or 300 so far. Debbie Boss says, did you know IG products now started showing antibodies in products starting November? Good for some of us getting IgGs. Yes. Thank you. Thank you. Thank you. Thank you. There is a Happy Healthy Life says, could you do an interview with Dr. Michael Greger, Dr. Esselstyn, or Dr. Dean Onish? Nutrition should be our main focus when talking about chronic disease. I can definitely do it. Can you do me a favor? Can you tweet this to me so that I can forward that tweet to my executive assistant and she can then start connecting them? Or if you have some way of connecting us to them, that would be even better. Thank you. Sports Card says, what is your take on lysine use with long haulers? I haven't seen any study so far with the usage. Barbara says, if ivermectin is so effective as a prophylaxis, why risk taking a vaccine that may cause side effects? This is something that I have talked about a few times before as well. And I am split. I'm on the fence about it. Here is how. Ivermectin is also not 100% efficacious. It also has 74% effectivity or something like that. That means there is still a risk with ivermectin as well. Number one. Number two, chronic use of ivermectin or continuous use of ivermectin is not very well studied. It is supposed to be safe. It is supposed to be not causing an issue, but still this is not studied. Vaccine given once trains our cells to be able to respond to the virus, and then we're done. That is why I still feel that if I'm given a vaccine, I'll take it. And if the vaccine is not there, during that time, the bridging capability should come from ivermectin. That's just how I think. And so that means it's a personal choice. Can the ivermectin be as competent as a vaccine? Let's say, barring the side effects, if vaccine is 94% efficacious like Moderna or Pfizer, ivermectin cannot probably rise up to that level. But even if it does, that's one time shot and done. You can still continue to take ivermectin. On the other hand, the Peru paper that I talked about, they say in there that the binding of ivermectin with the spike protein is just as good as it is a vaccine. I tend to not agree with that, but from a mechanism point of view, what they're saying is correct. So if we look at it from that lens, then there is no difference in a vaccine and ivermectin. And then you take ivermectin and not have all the effect of vaccine is fine as well. So I put together a few thoughts in front of you, your choice. Okay. So I can't see the person who is causing issues. Okay. Cool. So here we are. Thank you very much for being with me. Once again, please like, subscribe, and share. And if you would like, you want to be my patron, there is a link for that. There is a link to buy me coffees, and there is a link to support this work if you wanted to. So thank you very much, and I would see you tomorrow. Bye-bye.